Welcome to the Day Hospital Falls Program education video on bone health for older adults. What do you think that bones are made of? Bones are made mostly of collagen, which is a protein that provides a soft framework for the bone. And bones are hard because the rest of the bone is made of minerals that add strength and hardness. The primary minerals are calcium and phosphorus. This combination of collagen and calcium makes bones strong and flexible enough to withstand stress. More than 99% of the body's calcium is contained in the bones and teeth. The remaining 1% is found in the blood. Think of bone as a bank account where you deposit and withdraw bone tissue. During childhood and the teenage years, new bone is added to the skeleton faster than old bone is removed. As a result, bones become larger, heavier, and denser. For most people, bone formation continues at a faster pace than removal until bone mass peaks during the third decade of life. Eventually, bone withdrawals can begin to exceed deposits. Osteoporosis develops when bone removal occurs too quickly, replacement occurs too slowly, or both. You're more likely to develop osteoporosis if you do not reach your maximum peak bone mass during your bone building years. For many people, this bone loss can be prevented by continuing to get calcium, vitamin D, and exercise, and by avoiding tobacco and excessive alcohol use. If you have osteoporosis, you've already lost a significant amount of bone and may continue to do so until you receive medication. Here are some facts about osteoporosis. At least 80% of fractures in people 60 years old and older are related to osteoporosis. Hip, spine, wrist, and pelvic fractures are the most common type of fractures. If you've had a fracture, the chances of having another one increase greatly. Osteoporosis is a silent problem with few symptoms but may have serious complications. Many people do not even know that they have it. So you might be wondering, who gets osteoporosis and how common is it? 1.5 million Canadians have osteoporosis. 1 in 4 women and 1 in 8 men over 50 may have it. 1 in 3 women and 1 in 5 men will experience an osteoporotic fracture in their lifetime. Osteoporosis is less common in men than in women for a number of reasons. At menopause, a woman's estrogen level falls dramatically, and she usually loses bone more quickly. That's why women are especially at risk. Men have greater peak bone mass and don't experience the accelerated bone loss that women do at menopause. When it comes to osteoporosis, there are some risk factors you can change and some that you can't. Let's start by looking at the ones that you cannot change. Women are much more likely to develop osteoporosis than men. Family history is a risk factor. If you have a parent or sibling with osteoporosis, it puts you at greater risk, especially if your mother or father broke a hip. Menopause increases risk. The reduction of estrogen level in women at menopause is one of the strongest risk factors for developing osteoporosis. Body frame size. Men and women who have small body frames tend to have higher risk because they have less bone mass to draw from as they age. You're at greatest risk of osteoporosis if you are of white or Asian descent. The older you get, the greater your risk of osteoporosis. There are some medical conditions that increase your risk, such as celiac disease, inflammatory bowel disease, kidney or liver disease, cancer, lupus, and rheumatoid arthritis. Some medications increase your osteoporosis risk as well, such as long-term use of oral or injected corticosteroid medications, such as prednisone and cortisone. These interfere with the bone rebuilding process. Osteoporosis has also been associated with medications used to combat or prevent seizures, gastric reflux, or cancer. There may be a few things that you can do in order to make your bones stronger. Physical activity. People who spend a lot of time sitting have an increased risk of osteoporosis over their more active counterparts. Any weight-bearing exercise is helpful for your bones, but walking, running, jumping, dancing, and weightlifting seem particularly helpful for creating healthy bones. There are dietary factors. Making sure you have enough calcium is important, as is making sure that there's enough vitamin D. We will talk more about these factors later in the lesson. Monitoring alcohol consumption is important. Regular consumption of more than 2 alcoholic drinks a day increases your risk of osteoporosis. Alcohol may interfere with the body's ability to absorb calcium. There may also be a connection between caffeine intake and weak bones. You've probably heard many times before to quit smoking if you smoke. This is another example. The exact role that tobacco plays in osteoporosis isn't clearly understood, but researchers do know that tobacco use contributes to weak bones. Think about your own habits. Are any of these areas that you could make changes? Osteoporosis often presents with few or no symptoms at all, but some people may experience a fracture as the first sign. Some people have back pain or notice a loss of height, and some people will present with a hunched back, also called kyphosis. Formally, diagnosis of osteoporosis is done using bone density tests, such as the bone densitometry scan. This scan looks to see if the bone is as dense or as strong as it should be. But diagnosis is often made without testing when a fracture occurs in at-risk people. If you're diagnosed with osteoporosis, there are medications that you may be given, which may help the body to build new bone tissue or prevent the body from breaking bone down. The primary goal of drug treatments is to reduce fractures. Review the medication options with your doctor. Look at the risks and benefits that each offers and choose the best treatment for you. You may need to try different options because each person is different. People can have different responses to medications, including how effective they are and their side effects. So always report any side effects to your doctor right away. If cost is a factor, talk to your pharmacist. There may be different coverage plans that would work better for you. Aside from medications, there are those lifestyle changes that we were looking at before. Let's take a closer look at those now. We said before that calcium is important. What foods are a good source of calcium? What calcium-rich foods did you think of? For most people, dairy foods are the first to come to mind. Cheese, milk, yogurt. These are some of the prime suspects. Did you think of anything else? Some other calcium-rich foods that you may not have thought of include spinach, salmon, particularly with bones, or sardines, baked beans, almonds, white beans, and tofu. This chart shows you how much calcium is in some different foods. Ideally, we should aim for 1,200 milligrams of calcium in our diet per day. Dairy products such as milk, cheese, and yogurt are excellent sources of calcium because they contain high amounts of calcium that are easily absorbed by the body. Skim milk products provide as much calcium as whole milk with the added advantage of less fat and cholesterol. Some calcium-fortified soy beverages and orange juices may contain as much calcium as milk. Check the labels. Vegetables can also provide calcium, as do fish products containing bones, like canned salmon and sardines, and meat alternatives such as lentils and beans. Nuts and seeds are also a source of calcium. Calcium is very important for strong bones, but there is another nutrient that's its partner and is also very important. This nutrient helps the body to absorb the calcium so that we can use it. And this nutrient helps our muscles as well, which helps us to have better balance. What do you think it might be? I'll give you a hint. It's a vitamin. Were you able to guess what it was? The answer is vitamin D. So if vitamin D is so important, where do we get it? Our body makes vitamin D when it's exposed to UV rays from the sun. People who live in northern areas like Canada do not tend to get enough sun exposure to create enough vitamin D. There are very few food sources of vitamin D. The only naturally occurring ones are fatty fish and egg yolks. Milk, margarine, and some soy beverages and some orange juices are fortified with vitamin D. Cheese and yogurt can be made from vitamin D fortified milk as well. So as a result, it's generally recommended that people over 50, and particularly people with osteoporosis, take a vitamin D supplement. Talk to your doctor about whether or not you should be using a supplement. It's recommended that we get between 800 and 2,000 units of vitamin D every day in total. Looking at this chart, you can see that unless you ate an awful lot of salmon, this would be very difficult to do. You would need 22 eggs to get your 1,000 units. This is only 18 in this basket, or 10 cups of milk, or almost a cup of margarine. So maybe a supplement is a good idea. Okay, so we've talked about calcium and vitamin D, but there is still one more nutrient that's really important in keeping us strong and healthy to prevent falls and reduce injury. What do you think this one might be? This final important piece of the nutrition puzzle is protein. Protein is needed to build and repair body tissues, including bones. It makes bones strong and flexible. It also helps to build muscles, which are important for mobility and to prevent falls. Too many seniors don't eat enough protein or other important nutrients. Less protein means more fragile bones and weaker muscles. Weaker muscles can lead to poorer balance and more falls, and falls can lead to fractures. What foods do you think are a good source of protein? Protein-rich foods include meats, fish and poultry, beans, legumes and tofu, nuts, seeds and nut butters, eggs, milk, cheese, and yogurt. Try to include a protein with every meal. And don't forget, one of the most important things that you can do to stay strong and protect yourself from falls and injury is to exercise. In particular, weight and resistance exercises and weight-bearing exercises like walking and dancing are very good for strong bones. The force on the bones results in forming new bone and making bone stronger. It's good to do different types of exercises so that we strengthen all of the different bones. Physical activity improves our balance and coordination, which in turn reduces our risk of falls and injury. Improved strength, flexibility, and posture can also reduce pain and help people to do tasks more easily. And also, if you don't smoke, if you limit your intake of alcohol and caffeine, these will also help to reduce your risks for weak bones and injury related to falls. I hope you've enjoyed this presentation on keeping bones strong. Remember, each person will have their own goals. Diet and exercise plans need to be discussed with your healthcare team to make sure that they're right for you.